just because we can, and you can never see enough of this, Ranj is going to run us through the steps again.
Yeah, absolutely. So we're going to talk about baby CPR, and I'm going to try and keep it as simple as possible. Whenever anybody collapses, always make sure it's safe to approach. First thing you're going to do, and I'm going to demonstrate it on this doll over here, is just check for a response, and that might just be shaking them gently, calling out to them. If they're not responding, shout for help, get somebody to call 999. If you're by yourself, then you're going to have to give a minute of CPR for children, a minute of CPR before you go and get help yourself.
Right, OK.
First thing you're going to do, have a quick look, open the mouth, have a quick look inside, make sure there's nothing there. Support the head and look, listen and feel for breathing. What you're doing is you're watching the chest, you're listening for breaths, and you're trying to feel any breaths on your cheeks. You have to get really, really close down. If they're not breathing, give them 5 rescue breaths, which is what you did. So that's in babies, circle the nose and mouth with your mouth and breathe in, and ideally what you want to do is see the chest going up and down. You're going to do that 5 times. Then you're going to assess for any signs of life. So that could be movement, noise, they might start breathing, they might start doing things. If they're not doing that, start chest compressions. So that is 2 fingers in the middle of the chest, and you're pressing down.
So say you've got that bone there where you're sort of top of your ribs. Is it just below that
go
bit?
up that. Up from
so
there.
right onto the middle
right
bone.
between the nipples, essentially, is where you're going to go. So I said to people generally in the middle of the chest, and you're pushing down at a rate of 100 to 120 a minute.
That seems surprisingly hard.
Yes, and it's about a third of the depth of the chest you want to go.
Wow.
You want to do that 30 times, and then you want to go back to giving 2 breaths and alternate 30 compressions to 2 breaths. Now, you keep doing that until they come to, or help arrives, or you become exhausted. But if you're by yourself and it's a child, you do it for a minute and then go and get help.
Is this just what age up to? What age is this for? Because we say teeny tiny babies.
Yeah.
Like
so
Tommy.
this sequence is for any baby or any child. If it's an adult, the sequence is slightly different.
Okay.
If you don't know the difference, then just do the adult sequence, because as I said, doing something is better than doing nothing at all. And we get a lot of people saying, I've been taught to give 15 compressions to 2 breaths. That is the technique we teach to trained responders.
Right.
And for simplicity's sake, we are saying for everybody else, 30 to 2 is absolutely fine. If you're not confident giving breaths, then just give compressions, because doing something is better than nothing at all.
Okay.
And just follow the adult sequence if you don't know.
Thank you. Right. And that video is still on I think it's on our YouTube.
It's on our website, it's on our YouTube.
It's all over the place.
Share it.
Yeah, and St John's Ambulance have got lots and lots of other videos and, you know, helpful tips as well.
All right, thank you. Thank you for bringing us gorgeous Tommy. He's fast asleep now, so you just sit there and relax for the rest of the show.
We'll get someone to make you a nice cup of tea.
Yeah, exactly.